But it's really important to remember that MRD does not tell the whole story. So I mentioned several different MRD techniques that we use: flow cytometry, next generation sequencing, this PCR testing. But the validated MRD techniques in one disease state might not be the same as another disease state. So, for instance, in ALL, we have a long history of using a very good quality flow cytometry test to assess for measurable residual disease. In AML, it's a little bit more challenging to use flow cytometry. We do use it, but the validity is a little bit more in question than in ALL. In acute myeloid leukemia, AML, we have some disease types where there is a mutation or some sort of genetic abnormality that we can use MRD testing to track. But in many of the diseases, we don't have a trackable genetic anomaly that we can use for deeper MRD testing. So just because we talked about all of these different methodologies, it doesn't mean that all of those methods apply to every single disease state. In addition to that, the meaningful time points to assess MRD are very different across diseases. So in leukemia versus lymphoma versus myeloma, the meaningful time points where MRD has the strongest prognostic implications or has implications for treatment decisions will vary. And so no MRD concept from one disease is necessarily applicable to another disease. As I mentioned, the prognostic significance is different across different diseases. And then the role of MRD in actually changing management depends on the disease and the type of treatment the patient is receiving and the patient themselves. So an MRD positive test in somebody who is very fit and can tolerate more intensive therapy, the discussion around that would be very different from somebody who is an elderly patient who might have other medical problems that would preclude them from more intensive therapy. And so really the point is that all of these discussions have to take place with your oncologist and your team, and you should always approach your team to interpret the meaning of MRD results and have a discussion that is really patient focused and interpreted in the context of your particular case. So in conclusion, the concept of measurable residual disease has changed the way we think of remission in blood cancers. MRD assessment is done on a variety of body fluids and tissues and can be done using a number of different methodologies, which vary in their sensitivity. MRD status has prognostic significance, but the meaning of an MRD test really depends on the disease, the phase of treatment, and the patient's status. And discussions about any MRD result need to take place with your hematologist, oncologist, and your team. Thank you to everyone at Mount Sinai, all of my colleagues who help with our patients, and mostly to our patients and their families. And thank you to Grace for giving me this opportunity to speak.